the measles outbreak. There are now more than 700 cases of the illness in 22 states across the United States. It is the highest number on record since measles was declared eliminated back in 2000. The CDC says the majority of these cases involve children who have not been vaccinated. Measles is a highly contagious virus. Children and the elderly face the highest risk. So for more on this, let's bring in CBS News Chief Medical Correspondent, Dr. Jon LaPook. Good to see you.
Glad.
I've been wanting to talk to you for a while about this because as the news has gotten there have been so many reports of communities, Williamsburg, Rockland County, where I spent a portion of my childhood, that are now seeing a rise in these cases of young people being infected and older people. I've been vaccinated against the measles, but I can't remember the last time I had it. So now I'm really worried. So before we get into the anti-vaxxers and all that, for those of us who have been vaccinated along our lives as we were in school, should we be worried now?
I actually spoke to the CDC about this yesterday because there's been so many questions about it. And they say if you have 2 properly administered doses of measles vaccine, then you don't have to worry. You don't have to check your immunity with a blood test. You don't have to get another dose. And that's usually 12 to 15 months and then 4 to 6 years.
Right.
There are some nuances there. So about 1 million doses or so were given of the killed vaccine from 1963 to 1968, which may not be as effective. So you don't have to worry about that, right? You weren't around
no, I wasn't
in
around then.
1968,
No.
right? And then it wasn't until 1989 that ACIP, which is the big organization that recommends about dosage, said get a second dose. So it's possible that if you were born before 1989, you only got 1 dose. What's the protection? About 93%. It's still plenty.
Okay.
The second dose gives you 97%. So bottom line, and I've been going into this morning and yesterday, is generally, if you have those 2 doses and they're documented, you don't have to worry about it. If you do live in one of these areas where there's a big outbreak, you might think about talking to your doctor about should you get tested to see if you're still immune, should you maybe get another dose. There's really no harm to getting another dose.
I'm going to check with my mom because I know she keeps all of my vaccination records, and I'm pretty sure that I had 2 because I remember just as an older child getting another one. I think it was like a little drop that they put in your mouth, and I got another vaccine. Like it was MMR, rubella.
MMR is the shot.
Is the shot.
Because it's a live, attenuated virus, meaning it's a weakened virus.
Okay, got it. All right, so now let's talk about parents who, for whatever reason, are getting some kind of misinformation as to whether or not the vaccines are effective. What's going on there?
What's going on? And we just heard from the CDC this morning that there appears to be actually a directed campaign that's being targeted at, for example, in Brooklyn, the Orthodox Jewish community. And they are particularly susceptible because they tend to be an insular community. So they're not. A lot of them don't have internet access, and they're being targeted via robocalls, I'm told, and also via pamphlets. And some of those pamphlets, I'm told, although I haven't seen one, are in Yiddish. So they're getting this information, and it's part of this whole. Over the last several years, there have been talk about some people in that community being sort of encouraged by leaders not to trust science. And I think that is really at the base of all of this, right? It's that, and I've been going around all over the country. I've been in Oregon, I've been in Texas talking about this, I've been in Michigan. And at the base of it all is, why should I trust the vaccine companies? Why should I trust science? Why should I trust the CDC and the NIH? And, we're having now pockets. Still, nationally, we're over 90% immunization. We're having these pockets where people say, you know what, I'm not immunizing my kids. And what happens is when somebody comes abroad, that's where they're picking it up. So, for example, the measles outbreak in Rockland County, that started in October when somebody coming back from the Jewish holidays in September came back from Israel, brought the measles with them, and bam, were exposed to a community that really didn't have enough immunization.
So one of the things that I found really fascinating as we start to learn a little bit more about measles is how long it can live. If somebody with the measles infects you, or if somebody sneezes, this idea that the virus is still in the air or still on surfaces and it lives for quite a long period of
droplets.
time.
So it's aerosolized and it can be there for a couple of hours. And if you have not been immunized, and I have the measles right now, there's about a 90% chance that you're going to pick it up from me.
Just you and I conversing
Just you and I conversing like this. And the problem is that you're infectious even before you have obvious symptoms, before you have the rash. You can be for several days before.
So you won't even know, and you can then go and infect a bunch of other
people. And there's a concept called the R0, Vlad. R0 is how many people will one person infect on average. And with measles, it's 12 to 18. It may be 18. Wow. I mean, it's really infectious. You know what it was for Ebola? 2.
Wow.
So this is
really
a
remarkable,
very highly contagious virus.
So what should we be looking for if you think you may have been infected? I mean, when the symptoms arrive, and also we should point out, so that people don't freak out, that in terms of the highest risk cases, those are young children and the elderly, right? Yeah,
but anybody can have a bad side effects. But yes, in general, first of all, not immunized. So the majority of people who the CDC reported who got the measles were not immunized. Younger and immunocompromised people with cancer, older people. In Israel, there were 2 deaths in an outbreak in the last year of 4,000 people. And it was an 18-year-old girl and an 82-year-old, somebody in their 80s, a woman who was elderly. So these are the vulnerable populations. But, the symptoms can be just sort of runny nose, sneezing, sore throat. You can get some diarrhea. You can get some vomiting. Then you get fever, aches and pains, and you get those telltale spots that you can see. And then there are some other subtle physical signs that doctors can look for.
If you have it and you make it through, are you then immunized from it?
Yeah, once you get it, you should be immunized for life, but there are complications. So, generally in the olden days, right, before the vaccine,
right,
there were about 500,000 cases a year, up to 500,000 cases a year, and actually that may be an underestimate because that's reported, so they may be 4 to 5 million cases a year. And the mortality rate was 1 to 2 in 1,000. So you could have 400, 500 deaths in a year. You'd had thousands of people who were hospitalized. You had about 1,000 people who had severe inflammation of the brain, encephalitis. So yes, it's generally most people get over it, but it can have serious side effects, including pneumonia, by the way.
I've talked about this frequently. I used to live and work when I was on assignment in Africa, and I would go into communities, specifically polio. Nigeria, at the time that I was based in Nigeria, was one of the only countries. There were 2 countries in addition to Nigeria that had not eradicated polio. The other one was Pakistan and Afghanistan. And people worked really, really, really hard to get Nigeria off that polio list. And I would go into communities where people did not have the access to information that we have in the West, that did not have the medical technology that we have available to us in the West, in one of the richest countries in the world. And they would say, man, I wish I had access to what you had, Vlad, as a child growing up in the United States, that I could have saved or protected my children. And here in the U.S., we have all the information at our fingertips, access to doctors that are not only on television, but that you could just call up on the telephone and go and visit. And yet we're seeing this rise in this infectious disease, and it kind of boggles the mind. I'm just, from a philosophical standpoint, what do you think's going on?
Well, there's a lot of things that are going on, Vlad. First of all, people have forgotten about these diseases, polio, smallpox, measles. Right. They killed millions of people a year.
Right.
Aside from clean water, probably nothing's been better for public health than these immunizations. 1963, just look at the graph. All these hundreds of thousands of people with measles, 1963, the vaccine, boom, fell down to like in the 30s, several years later. So very, very effective. Ever since the beginning of vaccines, there have been people who have been against it, okay? So this is not something that's new, but what happened is in 1998, there was a bogus, discredited report in a very prestigious British journal called Lancet, claiming on the basis of 12 cases that there was a link between MMR, the measles, mumps, rubella vaccine, and autism. That has subsequently been totally discredited. It was a retracted article. The lead author lost his medical license. It was felt to be fraudulent. But it took 12 years, Vlad, 12 years before the investigations revealed that. And the damage was done. And it came at a time when what else was being born? The internet, social media, fake news. So you had this confluence of events, and then you have sort of an anti-science thing that's been happening in recent years. And it's the trifecta, and it's a formula for disaster.
Really, really good discussion, really good advice. Dr. Jon LaPook, always great to have you. Thank you. I've been wanting to talk to you about this and I couldn't find you.
I will come. I'm right here.
You're right here.
I'm right here in the Vladosphere.
The Vladosphere. That's it. We're going to make that happen one day, Doc.